Normal radiographic anatomy. Having an understanding of the normal anatomical landmarks will help you be able to understand and interpret the film, and then it'll help you when it comes to mounting. If you're not sure of what's normal anatomy and what may be something that's abnormal on that radiograph, you may mount your radiographs incorrectly. And things are going to be different on the maxilla than they will be on the mandible, so it's important to know the difference. But first, we should start with the bone. There's going to be two types of bone that you can see on a radiograph, and the first type is called cortical bone or compact bone, and this is the dense outer layer of bone. It is able to resist the passage of the X-ray beam, so it's going to be radiopaque on the radiograph. And right here where these arrows are pointing, and right here where these arrows are pointing, this is going to be your cortical bone. The next type of bone is going to be called the cancellous bone or the spongy bone. This is going to be soft and spongy, hence its name spongy bone, and it's going to be located between two layers of cortical bone. And it also has these little things called trabecula, which are bony pieces that form a crisscross pattern, or some call it a lattice pattern, with bone marrow in those spaces. These trabecula, they are going to resist the passage of X-rays, so they are going to appear radiopaque. So here where this arrow is pointing, where I am pointing the cursor, that is going to be the trabecula, and then where this arrow is pointing, the darker radiolucent area, is going to be your bone marrow. So just remember that it's the trabecula that are radiopaque, and it is the marrow that is radiolucent. So now let's start with the landmarks of the maxilla. And the first one I want to point out is the incisive foramen, also known as the nasopalatine foramen. And this is an opening or hole in the bone located behind the maxillary central incisors. So this is the actual bone here, and you can see this is the incisive foramen. And then we also have the median palatine suture, which is a joint. A suture is a joint that extends from the maxillary central incisors to the posterior hard palate. So that suture is going to extend from the incisors all the way back to the hard palate. So what do these two things look like on an X-ray? Well, the incisive foramen between the roots of the maxillary central incisors is where you will find it. And it's going to look like a small oval or a round radiolucent area. So this whole darkish colored area where those arrows are pointing is the incisive foramen. The median palatal suture, it's going to be also between the maxillary central incisors. It's going to be a thin radiolucent line between them. This is something that as time progresses, as the person ages and that suture begins to fuse with age, it's going to become less distinct on the radiograph, but when you can see it very distinctly, it is going to appear here. So that is your median palatal suture. And then on either side of it, you can look and see closely here. Get rid of, you can look and see, bring back my cursor here. Cortical bone. So there's a little layer of cortical bone and then a little layer of cortical bone here. But this thin radiolucent line is your median palatal suture. Next, we have the nasal cavity. This can also be known as the nasal fossa, and it is going to be above the maxillary incisors, and it will appear as a large radiolucent area that is sort of pear-shaped. So we have here and here. And it is going to be a compartment of bone located superior to the maxilla. So a little compartment of bone that is above the maxilla. And what divides the nasal cavity is going to be the nasal septum. It's a vertical bony wall. Some call it a partition. It's going to divide the nasal cavity into the right and the left. And on the radiograph, it will appear as a vertical radiopaque line above the maxillary central incisors. So the palatine suture was a radiolucent line. The nasal septum is going to be a radiopaque line, and that line is the line that goes right here, where those little arrows are pointing. That is your nasal septum. The next landmark is the anterior nasal spine, and it is the intersection of the floor of the nasal cavity and the nasal septum. And it will appear as a V-shaped radiopaque area. So right here is going to be your anterior nasal spine. And then we have the maxillary sinus. And the maxillary sinus is going to be located above the premolar and the molar teeth. It rarely will extend beyond the canine. You may see cases where it does, but it's going to mostly be above the molars and the premolars. And on a radiograph, it's going to be a radiolucent line located above the apices of the maxillary molars and premolars. I don't like the wording of that, so I'm going to go reword it and then I'll re-record this slide. The maxillary sinus is located above the premolar and the molar teeth, and it is going to extend from the molars and the premolars. Rarely, sometimes it will, but rarely it'll go beyond the canine. So you'll see it typically just in that premolar molar region. And on the radiograph, it's going to be the radiolucent area located above the apices of the maxillary, premolar, and molars. And the floor of the sinus is a radiopaque line. So this white line these arrows are pointing to, that is what we call the floor of the maxillary sinus. And then all of this radiolucent area is the maxillary sinus. Next is going to be the inverted Y, which is also known as the Y line of Ennis. And this is the intersection of the maxillary sinus and the nasal cavity. And on a radiograph, this is going to be a radiopaque upside down Y. And it is here. And then it's highlighted in yellow on the other radiograph there, just to give you a better idea of where its location is. And this will be typically found above the maxillary canine. The next landmark is the maxillary tuberosity. And this is a rounded prominence of bone that extends posterior to the third molar region. So kind of think of it as like a little bump that sticks out past where the third molars would be. And on a radiograph, it's going to be a radiopaque bulge distal to the third molar region. So this little bulge right here that those arrows are pointing to, that is your maxillary tuberosity. Next is going to be the Hamulus process. And I wanted you to be able to see it here first so you could understand it when you see it on the radiograph. So these little hook-like projections, this is your hamulus or your hamular or your hamular process or your hamulus process. And so your hamulus or the hamular process is a small hook-like projection located posterior to the maxillary tuberosity region. And on a radiograph, your hamulus or hamular process is going to be a hook-like radiopacity. And where these arrows are pointing, that I'm circling in the red, that little tiny hook is your hamulus. And that concludes the maxillary landmarks. So let's move on to the that concludes your maxillary landmarks. So let's move on to the mandibular. The first one we have is called your genial tubercles. And these are tiny bumps of bone. So these little projections here, these tiny bumps of bone that serve as an attachment site for the genioglossus and geniohyoid muscles, or muscles of the tongue. So it's an attachment piece. On the radiograph, it is going to appear as a ring-shaped radiopacity below the apices of the mandibular incisors. So the arrow is pointing to it, but I'm going to go ahead and circle it. And that ring-like radiopacity right there, that is your genial tubercle. And then we have the lingual foramen. This is beneath the apices of the mandibular incisors as well. These are both going to be on like the looking out from the lingual portion of it. And on the radiograph, your lingual foramen is going to be a small radiolucent dot. So here on the actual bone, we've got the lingual foramen. And then just going to make a dot here. Where that red dot now is, there is a radiolucent dot. That is your lingual foramen. This is located near the midline, and it's also surrounded by the genial tubercles. So you may see that lingual foramen surrounded by the radiolucent. You may see that lingual foramen, which is a radiolucent dot, surrounded by a radiopaque circle. Those are your genial tubercles. The mental ridge. The mental ridge is something that extends from the premolar region to the midline and slopes slightly upward. And this is cortical bone. It's on the external surface of the mandible. And on a radiograph, it's going to be a thick radiopaque band that extends from the premolar to the incisors. So this radiopaque band right here that I'm tracing over, that is your mental ridge. The mental foramen is an opening in the bone, and it's on the external surface of the mandible near the premolars. So on the exterior portion near the premolars. And on a radiograph, it's going to be a small oval or ovoid or round radiolucent area near the apex. So here on the actual model or the skull, and then here on your radiograph, that is your mental foramen. And this is where you will have blood vessels and nerves that will come out of it that supply the lower lip. And with this one, the angle of it, depending on the angle that you're taking the x-ray, the angle or the placement of that foramen can kind of move, which is why sometimes it's misdiagnosed as some kind of lesion or a cyst or an abscess because of its location. The next landmark is the mandibular canal. And this is a tube-like passageway through bone that travels the length of the mandible. Think of a canal, like a water canal. It's a passageway. So the mandibular canal is the same thing, but it's just a passageway through the bone. And on the x-ray, it's going to be a radiolucent band along the mandible. So on the bone, all of this yellow is traveling along here. That's your mandibular canal, and then it's going to branch out. This is a lot of times where the anesthetic is given. And then over on the radiograph here, this is your mandibular canal. And it is the radiolucent area, but it's going to be outlined with two thin radiopaque lines. That's cortical bone. That is going to be the wall of the canal. And this canal can either appear directly below the molar teeth, or sometimes it is superimposed over the apices. And then we have the myohyaloid. And then we have the take 3. Then we have the mylohyoid ridge, which is a linear prominence of bone located on the internal surface of the mandible that extends downward and forward from the ramus. So think of this as the lingual portion. So when you are looking at this view up here, this picture, you are looking as if you are standing on the back of the tongue. So these are going to be on what they're calling the internal surface of the mandible, extends downward and forward from the ramus. And on the radiograph, it's going to be the radiopaque band that extends just like the description, downward and forward from the ramus. And then we have the external oblique ridge. It's a prominence of bone located on the external surface of the body of the mandible. So think the outside, the external surface. Then the radiopaque band on the radiograph, it's going to be a radiopaque band extending downward and forward from the anterior border of the ramus. So where these arrows are pointing right here is going to be the external oblique ridge.